All right, good morning to members of the media, and once again, we apologize for the technical difficulties that we had before, but we thank you for joining us this morning for a press conference on COVID-19 from the Democratic Labour Party. With me this morning, I have President Verla de Pisa and also our spokesperson on tourism, former Minister Richard Seeley. And I am Andrea Worrell, Vice President of the Democratic Labour Party and spokesperson on health. We've called this press conference today because we recognize that Barbados is under siege as a result of COVID-19. The Delta variant is taking the lives of our loved ones, making thousands of others sick, with untold suffering and hardship. Our current COVID-19 death rate stands at 124 persons. 116 of those deaths occurred in 2021, and with 75 related to the current surge, which started from just around July this year. It does not matter if those persons were vaccinated or unvaccinated. These are our loved ones, our grandparents, our aunts and uncles, someone's neighbor, co-worker, or friend. Is enough being done to protect the lives of Barbadians, especially the elderly? And that is the question that we are putting out to the government and for you, the people of Barbados, to also address for yourself today. We are also on the siege because the government fails to act. The government refuses to take recommendations from the Barbados Association of Medical Practitioners. The government talks about following the science, but is hell-bent on following the business lobby. The government is hell-bent on also following what is public opinion, rather than making the hard decisions and providing the leadership that is important at this time. We are concerned about the laissez-faire approach of the Motley administration to the management of the COVID-19, which has resulted in the Delta variant. Now, I will just share some statistics with you. For the month of October, we've had a positivity rate rising from 11% in the first week, 7-day average in the first week, to 12% in the second week, and now it is trending towards going towards 13% in the third week, which will come to an end roughly on Friday or Saturday. And even in this third week, we are seeing averages as high as 16% positivity rate. But yet still, we are not seeing any interventions from the government. We have an attitude from the government that they're just going to let COVID take its course. And unfortunately, that means that our elderly are at risk. Families are in mourning and in suffering. And this concerns the Democratic Labour Party, and we are urging the government to take some action. Now, if we follow the science, we must lean on the best available advice of the doctors. We must let the public health experts lead in public crisis. If we are to have our livelihoods, and if we are to have our economy safe as well. We must stop the devastation of COVID in weakened communities across this country. We are concerned about the strain which is being placed on the healthcare system. You've heard the doctors complaining. The chief medical officer, more than 2 weeks ago, described the situation as dire for the healthcare system. We know that they have implemented the home isolation program, and now to take some of the pressure off of the isolation facilities, and now that we know that that program has its flaws as well, because persons have been waiting for days or even for weeks. Some people have even been forgotten in the system. They're not getting the type of treatment that they ought to get, the type of feedback, because our healthcare system does not have the capacity to deal with over 4,000 people in isolation. And this is not just 4,000 individuals, but you also heard the business sector complain as well, because it is a whole household that more or less is quarantined. So if the businesses are not locked down altogether, doors are constantly closing one by one across Barbados. The president of the Chamber of Commerce described this dire situation earlier this week when he mentioned that there are burdened in terms of HR shortages because persons who are in isolation, one family member, and you have other people, workers who have to stay at home, who cannot come out, and yet still they have to meet the wage bill for all of these things as well. This calls for serious intervention. Something better needs to be done for all Barbadians. You cannot treat COVID with PR. You need to apply some medical advice to COVID. The DLP knows that it requires a balance, and a balance of what doctors say is required with the ability to earn a living. Well, if we are to follow the science, if we are to save the economy, we first need to solve the immediate COVID crisis, which is the rampant community spread. And the DLP is calling on the government to strengthen the COVID protocols by implementing the following targeted COVID containment measures. And for this, I would ask our President Verla de Pisa to discuss more on these containment measures.
Thank you very much, Comrade Andre. Is the media settled? Okay. Thank you very much. Now, I just want to reaffirm that the Democratic Labour Party has been in touch with the medical field, and we are satisfied. Matter of fact, what they have to say on this issue is not a secret, because they have been coming out and letting everyone in Barbados know what medically needs to be done to redress the situation. Now, we also know that we have an economy to manage as well, but certainly to reinforce the point that Comrade Andre made, the business community cannot be happy with the way the situations are now. The workforce is negatively impacted. I spoke about this Sunday at the St. Lucie branch meeting, because you have a constant turnover of your employees, with some of them home in isolation and others in quarantine because they've been contact traced. It is difficult to run a business in that environment. I've had small businesses call me complaining because for them it actually means a closed door. If you are a 3-person establishment, a 5-person establishment, this is something that goes to the root. And then the very livelihoods that we hear the government speaking about saving are also in danger because they can't work. This has been a situation that has been with us for this long, and the Democratic Labour Party is satisfied that it is because of the government's mismanagement of the situation. We really cannot get away from that reality. There must be positive steps taken, not just a wishing for better, but positive steps taken, because the way we live and the way we do business matter, and Christmas is upon us. Christmas is not only the busiest season for commerce, it is also the busiest season in the lives of our people. We spruce up our homes, we spruce up ourselves, and we relax with friends and family. If there is one thing that COVID has driven home, is how much mental health is also important in how we are managing COVID. And so with Christmas just 2 months away, we have to be mindful of what we are doing to stem the flow, stem the deaths, we really need to be cutting back on what we are doing now so that we can have a good Christmas. And let's face it, safe zones are a concept that you could probably talk about months down the road when we have a higher vaccination rate. But right now, when you're talking about safe zones, you're actually talking about segregating the society, almost splitting it down in half. Because when I look at the numbers, we're barely scraping 50% fully vaccinated. And that means that when you're speaking about a safe zone, you're talking about excluding half of the society. That cannot be a meaningful solution at this time. There has to be a policy and a focus on breaking the transmission now in the short term, and not only speaking about long term or even medium-term measures. What are you going to do now to fix the problem? And the Democratic Labour Party for the past week or so has been talking about what needs to be done now. We choose to call it targeted containment measures because we know that no one wants a full lockdown. And let's face it, a full lockdown will exacerbate the situation. But what we really need to be talking about is how we manage strategically how we move and how we do our business and how we relate to each other. And when I speak about this targeted management, I'm speaking in terms of things that are not foreign, things that we have tried before but we need to get back to. And that is working from home. This really is a strategy that has to be employed because when we have people working from home, we have less of them on public transport, we have less on the roads. We also need to have these containment measures to be dealing with an e-commerce push so that we have less persons going into businesses, but businesses still being conducted. Because at the end of the day, you're looking to find that balance. The Democratic Labour Party takes a lot of licks, and we can say it every time because we're proud of our mantra that we are more than an economy, we are a society. And what that means is that you're not leaning towards one more than the other, but you are looking for balance. And that really is what is missing. But another feature that we could be looking at in order to address it is to have longer business hours. We saw that shorter business hours cause long lines because everybody is rushing to do their business at the same time within the shortened time frame. But if we have longer business hours, then there is a more casual attitude towards getting your business done. And there is less likelihood of that overcrowding that we see all now, the long lines outside of the banks, in the rain and in the sun. We have to be getting away from this and thinking creatively about how we can address COVID. And we think that this is necessary, it must be done now. And alongside all of that, we spent some time indoors in February of this year, and we were visited by UE students who were collecting information. That information now is very pertinent for targeting our communities. You know where the hotspots are. We have the household information. Target them for testing. We need to have a major ramping up of the testing. Any WHO release speaks about knowing your status, and the only way you can know it is if you actually have a test. We hear almost on a nightly basis, test, coming from the doctors, and that is what we need to do. It is not just about expecting people to come to the testing sites, but we can take the testing into the communities, just like we have taken the vaccines into the communities. But again, taking the vaccines into the communities has got to be more than parking a mobile unit on a pasture and expecting people to come out. What about knocking on the doors and having that conversation, the education, to bring the people out, to bring them to understanding? Because we spent some time castigating people for being anti-vaxxers, when really what I am sensing is a lot of hesitancy. And that void can only be filled with education. And this has been the stress of the Democratic Labour Party since February of this year. So really and truly all we are doing is repeating and reinforcing, because these measures need to be commonplace now. This is what we need to have as our COVID plan going forward so that we can reach some level of normalcy. It was very disheartening to hear that the state of emergency is extended to March of next year. That will be 2 calendar years. And if only we managed it better, we would be able to function better within Barbados. And it has so much more than what we are doing right now. In terms of our borders, the tightest of controls at the borders is necessary. It is not enough for the minister to say that we have strong measures at our borders and that we are catching them at the borders. The fact of the matter is that COVID got into the community because it was brought to Barbados. So therefore, we need to have that containment at the borders to be at its strongest. And once again, we need to be following the science where those quarantine protocols are concerned with traveling. Because at the end of the day, we catch at the tourist dollar and spend it on health. And that cannot have a positive effect on our economy. And it is not enough for the minister to constantly speak about uptick in bookings when we are also hearing the Patels speak about the uptick in cancellations. And it is because the situation in Barbados has reached the stage where we are breaking dubious records internationally. There is no way Barbados, how we started out last year, should be at this position now. We should never be at the top or bottom of the chart, depending on how you draw it, where COVID spread is concerned. That is a situation that we have to redress as a matter of urgency. And of course, all of the usual, what I choose to call the passive protocols, the social distancing, the washing of hands, the wearing of masks, all of that to continue as well. It is not one thing without the other, but it has to be a concerted effort, and it has to be led. We must have leadership on it. I am so pleased to see all of you in here wearing your masks, because that is part of the containment measures as well. We have to be doing all of these things, but we have to get everybody on board with it. And the easiest way to do that is to have the leadership that is putting the correct protocols in place, putting the correct initiatives in place to allow us to be making choices now that will allow us to have a better Christmas. I call it saving Santa, because we know as Barbadians, Christmas in the park means a lot to us. Pulling down the house, putting it back up, pulling down yourself, putting it back up, because we doll up for Christmas. You know, we make the most of the moment, and it is also the season that brings the most revenue from tourism. So it should be of critical importance now that we do what is necessary. Take those steps now. Christmas is 8 weeks, 9 weeks from now. If we do this starting now, and under the guidance of the doctors to know when it is we can move out from those positionings, although I am satisfied that e-commerce can remain with us for good. Longer opening hours, we've been talking about the 24-hour economy for the longest time, and here is the opportunity to put it in place. So these need not be short-term measures only. These could be measures that we learn to live with comfortably going forward, because it allows us the space to social distance, and it also allows us the freedom to maneuver our business. And that is really what we need at this time, to have a plan that allows everybody, not having an us and them mentality, but having a plan that allows everybody to function in society and to do so in a meaningful way. And the Democratic Labour Party stresses all the time, it has to be that you don't just say that you are following the science, but that you actually do it. Because at the end of the day, the impact is on lives. The impact is on people. our people are suffering. For each one of those deaths, there is an entire family, business colleagues, friends, neighbors that are negatively impacted. And it cannot be that as a nation we are satisfied with almost 5 deaths a day, that we are satisfied that almost 400 positives a day, that we are satisfied with almost 4,000 in isolation, and therefore activities totally curtailed for some extended period. And then, because we know that this is a crunch on our health care, it is an imperative that we get a handle on this now. We have focused so much on COVID that we have not put the resources, we don't have the residual resources to manage anything else. The doctors are at capacity. They've been telling us this for the longest while, and it is time the government listens. It is time that the people of Barbados insist that the government listens and that we do what is necessary and what is right to fix the problem that we have immediately and stop talking only about medium to long-term solutions. Thank you. Thank you. Have you all got any questions? We're happy to take questions from you.
You have mentioned the issue with UGA and seems talking different when it comes to the numbers of health. I just want to get your take on that to see how this goes on. You may have happened to you. All right. How do you know?
It is, as I said earlier, the thing with statistics is that you can wield them as you like. If you look at the chart in relation to bookings, it probably looks healthy. But if you look at that in isolation, then you miss the larger picture. So having an increase in bookings is not sufficient. We also have to hear and digest what the hoteliers are saying in relation to the cancellations, and that is worrisome. And I just cannot get it through my head how the Minister of Tourism ignores that aspect when she speaks glowingly of our winter season. The hoteliers know better. It is great that we have expanded airlift. I believe that was in the works for some time. But at the end of the day, will they be full? Will they be coming here? The inaugural flight, fine. But what about after? And I mean, bread and butter for most Barbadians is tourism. So we have to have a critical eye to all of the statistics. We can't just pull out the ones that suit us because they don't give the correct picture. And we need to be fixing our internal issues because, believe you me, I've been following the travel blogs. The tourists know what is going on here. It is a fallacy to speak to our vaccine level being the reason for the cancellations, because they knew what our vaccination level was when they booked. The critical issue is the rate of infection within Barbados, and do you run that risk on vacation? That is the critical factor, and that is what we need to be addressing as a matter of urgency to bring Barbados back up for our own health first, and then to have a tourism product that we can offer to our guests.
Okay, I also have some questions that are being shared with me from members of the media who are following the press conference online. One of those questions specifically about the party's position on safe zones, and vaccination. And just to reiterate, as a spokesperson on health, that the party views safe zones as being premature at this stage, that you need to look at controlling the community spread of the virus. And as the president would have mentioned in her recommendations being outlined, that what the safe zones would actually do is a matter of segregating the population, because we don't have enough persons vaccinated as yet. If you reach a vaccination level of, say, 70%, then you can look at introducing the safe zones, because more and more persons will be able to participate in the businesses that have these safe zones. Yes, we support the idea of safe zones for healthcare institutions and those people that deal on the front line in terms of the treatment of COVID. Also, some other issues with regard to our vaccination policy. The party fully supports vaccination, but we also make a call for testing. Vaccines, we recognize, do play a role in fighting the COVID virus in terms of reducing the severity of the illness, and we will continue to support that and ask that the campaign be intensified with education, going door to door, going to those elderly persons who were supposed to be in the first tranche of people to receive the vaccines, and make sure that they have an opportunity to get it. I appreciate that the government has said that they would utilize the Johnson & Johnson's vaccine, which is a single-dose vaccine for those persons, and we are hoping that they get the logistics in place to have that done. Our measures, we do not necessarily speak to a lockdown, but our measures speak to as a way of keeping the country open, but containing the spread of COVID. In doing that, utilizing restricted movement, more persons, as the president would have mentioned, working from at home where you have the capacity to, build up our ICT technologies, have longer opening hours to reduce the crowding, and basically allow financial institutions, supermarkets, manufacturing companies to open at their discretion with an extended curfew period of time that persons can work, reduce working numbers in the business, set those limits, and also when it comes to dining, utilize open air dining, and to some extent, we really need to consider restricting indoor dining, because that would help to increase the spread. Utilize open air dining wherever possible, or pick up and go as you would have done before. That way, you can curb the spread and allow the economy to continue to open and flourish. But if we do not curb the spread, this trickle-down approach, the drip measures that are being implemented will see us being at a stage with positivity rates in 14% for a much longer period. And as the president said, we need to save Santa. So we need to save our Christmas period. Don't know if there are any other questions from those of the media who are here with us.
Well, because those of us who are more au fait with technology would be using the e-commerce platforms. That is the intention. Then it means that those who are not so familiar with it, like the elderly that you're speaking about, they will not have a crowding when they go to the supermarket, because people like you and me, we purchase our groceries online, and they can go to the supermarket comfortable that they will not have to stand up in the hot sun and collapse as we saw happen. They would just be able to go in and at their leisure, we'll know what the numbers are for each building, and they would not be butting up on me in the supermarket. They would be free to go at their leisure, so they'll know that I am in front of my computer working at 11, 12 o'clock, and that is a good hour for them to go to the supermarkets. Right? So the longer hours allows for you to make those decisions, as opposed to corralling everybody into the same set of hours, causing supermarkets and businesses to close early, and then we're left with the long lanes outside. We would be able to have traffic flowing. And let's face it, if they're opening longer hours, there's greater employment opportunity out there as well. So we have to think these things through, come up with solutions. The Democratic Party is not suggesting that we have all, but it is clear that the government has none. So we're throwing some out there for the discussion and the deliberation.
Along the corridor, especially from Bridgetown to Paradise. What's your take on those laws from government? We've been promised a lot of investment. We've been hired some years in Bridgetown along the corridor going to Paradise. But we haven't been seeing them.
Answer this own question.
No, we haven't been seeing them, no.
That's your old question. That's it.
What is there that we need at this time in the area of tourism? You're talking about areas coming here.
A plan would be nice. A plan would be nice. I'm not detecting one. I suppose I should take this opportunity to congratulate Anita and her team. The flight out of Schiphol, KLM, something that we were working on for a while, and it was nice to see it come to fruition. And we put her in place largely because of opportunities like that. It is not that we expect to get a lot of Dutch coming here, but Schiphol is a very important hub airport. Along with Frankfurt and Charles de Gaulle out of Paris is probably the next largest in Europe. So Holland, small country, but a large hub. And we can even get Germans and who find it more convenient to come out of Schiphol than to fly out of a German airport. So it should be good for us. So I'm happy about that. The aircraft is a large aircraft, and it's an A320, I think it is. And I suppose the load factors will be low, but still good for Barbados. And I look forward to see how that will work. I think we're doing it jointly with Tobago. There was a KLM inaugural to Trinidad, and they will hardly deploy two large-bodied aircraft like that. So I guess we're doing a double drop, as they call it. And I hope that all the people don't get out in Tobago and not come here. I hope not. But that double drop concept has worked well. It worked well with us with the Condor flights out of Germany. So I hope that can occur. And the Aer Lingus one, I did a lot less work on that, admittedly. But that too is good. Good connections between Ireland and Barbados historically. The Standard Bearer for St. John will tell you about the people up there, the lighter skinned people. It's a very derogatory term they use to describe them. But they are of Irish extraction, historically strong connection with Ireland, and of course more recently at the corporate level, Sandy Lane and Digicel, just to name two, controlled by Irish business interests. So the Aer Lingus thing is good. So there's some good things happening. I wait to see how the winter season will obviously develop. The news out of the UK is not very good in terms of COVID. And unfortunately, because of how things work, especially where they're largely driven by tour operators, you're really not going to be able to get to know the cancellations until further down. It's okay to be dismissive, but frankly speaking, September, October, yes, those are your trough months. But if you're getting cancellations in your trough months, if anything, you should be even more worried, because that's when you want business. And what I found compelling about the Gertrude Carter story was that she went to a cross-section of hoteliers. Wayne Capaldi, of course, the higher end, and Renee on the other end, in terms of BHJ classifies hotels by group. And then in the middle, you had Patricia Das and the Sun Group, and all saying the same thing. And these people are not canceling their vacations, you know. They're canceling to Barbados. My understanding is they've gone to the Seychelles and elsewhere. And that is a little worrying. Gloating over winter bookings is not a response, because the truth is you are probably going to see cancellations, but closer to the time. You're not going to cancel now for a vacation planned in February. And so I think that it is, again, you need a plan. We don't have a plan. It is obvious over and over again. I am mystified by the apparent difference of approach, or should I say, the BHJ and the government being on opposite pages is a complete mystery to me. And if there was one thing I did in my 10 years at tourism, is I maintained that I was always on the same page with the private sector, even if we were not always in agreement. I used to see Sue Springer more often than many of my colleagues. If a week passed that I didn't see her, you better believe the following week I did. And the ironic thing is, the characters that I was dealing with were card-carrying members of the Barbados Labour Party. Ian Gooding-Edgell, Colin Jordan, Rudy Grant. But we understood the importance of the sector to Barbados. Here we have a situation where some of those same people are now part of a government that is at odds with the BHTA. It is beyond puzzling, and it needs to be rectified. This is not a time to play games. This is a time to get on the right page as soon as possible. Public health considerations are going to become even more acute, because I understand from Monday the government is going to stop requiring the second test for visitors coming into Barbados. No doubt this is in response to what's happening in the rest of the region. As you know, destinations are throwing open the door altogether. St. Lucia from November 1. Well, Antigua's throwing open the door with everything shortly, apart from what we're hearing from their prime minister. So the question is, again, the cancellations and how we manage them, and where these people are going to go. Because they're not canceling their vacations, they're canceling Barbados. And we need a plan. President Jeffrey Roach, again, very level-headed, intelligent, experienced man. And I get the impression that he wants a more meaningful audience with the government. His utterance, I haven't spoken to him personally. Last time I did was when I congratulated him on becoming president, and I tend not to over-talk with people, because I don't want anybody to think I'm trying to get information for any political anything. I congratulate them on how are things going, how's the family, and that's the end of that. But I get the impression that Jeffrey really wants to engage with the government. The government's not engaging, and they need to start doing that and get down the road with this business of tourism. Thank you very much.
you to the members of the media and for your questions as well. And at this time, we will wrap up the press conference, and just to further reiterate the call for the government to do more in terms of reducing the spread of COVID-19. We're not talking about a lockdown, but to think outside of the box in terms of measures that you can still restrict movement and also keep the economy going. It's all about the capacity of persons within organizations, reducing the clumping, reducing the clustering, and also testing as many people as possible to find those out there who are positive. It is about saving livelihoods in Barbados, saving our elderly, and saving our families. I thank you very much for joining us today, and we will release more information and specifics with regard to our COVID policy over the next couple of days. Thank you for joining us, and have a good day.